Wake up, Jacob. It is me, he, and before we get started, housekeeping, housekeeping. Like, share, subscribe, hit the notification bell because I don't want you to miss any of the content. Just wanted to jump in and give you guys a quick article, real quick, and it was talking about. And this happened earlier this month. It says hospitals got bailouts and furloughed thousands while paying CEOs millions. That happens all the time. This is how they feel these bailouts are going to work. And I just got to say, as a quick aside, on a basic level, we got to realize that when they print money, it devalues the money in your pocket. It brings down the value of the money that is in your pocket, right? That's what's going on, right? That's what's happening. So just keep that in mind. But it says HCA Healthcare is one of the world's wealthiest hospital chains. It earned more than $7 billion in profits. $7 billion in profits over the past 2 years. It is worth $36 billion. It paid its chief executive $26 million in 2019. But as the coronavirus swept the country, employees at HCA repeatedly complained that the company was not providing adequate protective gear to nurses, medical technicians, and cleaning staff. Last month's HCA executive warned that they would lay off thousands, of nurses if they didn't agree to wage freezes and other concessions. A few weeks earlier, HCA had received about $1 billion in bailout funds from the federal government, part of an effort to stabilize hospitals during the pandemic. Okay, so $1 billion, and yet you can't get gloves. You can't get adequate. Let's continue, man. HCA is among the list of deep-pocketed healthcare companies that have received billions of dollars in taxpayer funds, but are laying off or cutting the pay of tens of thousands of doctors, nurses, low-paid workers. Many have continued to pay their top executive millions, although some executives have taken modest pay cuts. Yeah, really modest. You're making millions and millions and millions, and I'll take a pay cut of 100,000, but if you're making okay, the New York Times analyzed tax and securities filings by 60 of the country's largest hospital chains, which have received a total of more than $15 billion in emergency funds through the economic stimulus package in the Federal CARES Act. The hospital, including publicly traded juggernauts like HCA and Tenet Healthcare, elite nonprofits like the Mayo Clinic, and regional chains with thousands of beds and billions in cash, are collectively sitting on tens of billions of dollars of cash reserves that are supposed to help them weather an unanticipated storm. And together, they awarded the 5 highest paid officials at each chain about $874 million in the most recent year, for which they have disclosed their finances. At least 36 of those hospital chains have laid off, furloughed, or reduced the pay of employees as they try to save money during the pandemic. Industry officials argue that furloughs and pay reductions allow hospitals to keep providing essential services at a time when the pandemic has gutted their revenue. Okay, but quick question, how do you keep providing these essential services if you are cutting people and laying them off and then not giving them the equipment that they need to safely help other people? Just a thought. But more than a dozen workers at the wealthy hospital said in interviews that their employers had put the heaviest financial burdens on frontline staff, including low-paid cafeteria workers, janitors, and nursing assistants. I wonder, why are we going after these people who, by comparison to CEOs, have paltry incomes, and we are cutting them and letting them go? And these people are the frontline people, your janitors, nurses, and things like that, and these aides, who does a lot of the heavy lifting. But we are to cut their pay, get rid of them? Interesting. They said pay cuts, They said pay cuts and furloughs made it even harder for members of the hospital staff or the medical staff to do their jobs, forcing them to treat more patients in less time. Even before the coronavirus swept America, forcing hospitals to stop providing lucrative, non-essential surgery and other services, many smaller hospitals were on the financial brink. In March, lawmakers sought to address that with a vast federal economic stimulus package that included $175 billion for the Department of Health and Human Services to hand out in grants to hospitals. But the formulas to determine how much money hospitals receive were based largely on their revenue, not their financial needs. Wow. As a result, hospitals serving wealthier patients have received far more funding than those that treat low-income patients, according to the study by the Kaiser Family Foundation. It's kind of like how they do. So they're doing the hospitals, and it's kind of like how they do the schools, right? Where a school, you know, how they get their funding, right? So if you have this low-income school or whatever, you gotta meet certain requirements. Okay, you gotta get these grades, gotta meet certain requirements. If they're not passing, if they're not doing that, they get less funding. And then the wealthier schools, or the schools that have, money and they, don't pass or whatever, they'll get more money. It's backwards. So the underserved hospitals, the hospitals that don't have quite as much funds, they need more funding so they can get the things that they need, so they can pay the people, so they can help. Based on their revenue, they're only going to get a little bit of money. So the hospitals with a lot of money and a lot of revenue, more profits, they get more funding. Just like in 2008, and they were doing the bailout, and we had the mortgage crisis and things like that, and they were giving all these banks with these mortgages, they're giving them bailouts and stuff like that. And I'm like, okay, well, why don't you give the money to the people who have the mortgages, who owe the mortgages, and just put it in such a way that the only thing they can spend the money on is the mortgage, right? So now you help the person who has a home, you help them pay their mortgage, because when you give them the money, the only thing they can use it on is their mortgage. They give it to the mortgage company. The mortgage company get the money that they're asking the government for, but they're giving it to the person. So now that person who has the house is now current on their mortgage. So you help them. The mortgage company is, so they're not defaulting. The mortgage company get the money that they want so they can stay afloat. So you help two people. But instead of helping the people, help the company survive. Guys, I don't even know what to make of all this. I couldn't even finish the article. I don't even know what to make. This is crazy. Okay, this is absolutely crazy. This is ludicrous, right? This is ludicrous. So more and more bailouts are coming down the pike, and where does that leave you and I? Where does that leave our money? While you have the money, you better use it. You better get the essential things that you need. You better get your seeds. You better get your building materials. You better get your food situation ready to go. You better get your livestock if you're able to do that. Get your chickens and your goats and your cows if you can afford that. You better get all that stuff before money is pretty much worth the paper that is printed on. Get it while you can. This is that grace period before the other shoe drops. I don't know. This country, man. I don't know. You guys tell me. Those are my thoughts. You guys tell me. And like, share, subscribe, hit the notification bell. I'm gonna see you guys on the next one. Israelite Purple.